So our content today, we are going to talk about the changing regulatory climate and really what led up to this guidance document. And I'm a little surprised we haven't had an amendment from the amount of guidance that we've had related to each other. So in 2003, by the way, FDA proposed an amendment to their safety reporting requirements to become, really the effort was to become more international and calling things like SUSARs and other things like that. And it never went anywhere. It's still floating out there as a draft, and that's a long time for a draft to expect it to go to approval from 2003. About 5 years, we see, is typical. And guidances take about 2 years, it seems, unless they're really being pushed through. So the regulatory climate is here, and we'll talk about what led up to this guidance document and some things that have happened even since. And we'll talk about the response globally and recommendations to get meaningful safety reporting between different stakeholders, so between the sponsor, the ethics committees, the investigators. And FDA's response to some of this changing global climate and actually they had a lot of complaints come in about certain stakeholders' responsibilities. So they came out with an April 2007 draft guidance to address some of these concerns, and then it was finalized in January of 2009. And we'll talk about the differences between the draft and the final. I feel we learn a lot from the draft guidances because they tend to have more information in them about what led up to their decision to do a draft. And then sometimes they pull out that information and add or subtract whatever the content final is going to be. But the Office of Human Research Protection within the government-funded studies for the Common Rule, this changing global requirement and just the change of how our studies, the study population and just really the makeup of them, they had a response, a final guidance document earlier than the FDA's draft, and it was finalized in 2007 of January. And you'll see why these dates are important as we move through this. So we'll talk about the implications of current practice, and we'll use some case scenarios from before this guidance hit and some after.